Noticing bad breath that doesn't seem to go away no matter what you do? Hi, I'm Anna Peterson. I'm a dental therapist, and today I want to clear the air on halitosis and show you how to stop it for good. Bad breath can be really embarrassing, but overcoming it is all about understanding what's caused it. Certain foods can briefly cause it, but mainly it's caused by poor oral hygiene. I'll show you using this model of teeth. Plaque bacteria multiply as they feed on the sugars in your mouth. They then excrete sulfur compounds, which is where that bad smell comes from. So to prevent this happening, we need to brush the bacterial plaque away. And the most important time to do this is before we sleep. When we sleep, we produce less saliva, so the bacteria in your mouth can really thrive. And if you've left a full day's accumulation of bacterial plaque and food debris, then the bacteria in your mouth are going to have a full-blown party. Switching to an electric toothbrush like the Oral-BiO can make a huge difference. As you can see, manual toothbrushes have a hard time cleaning those hard-to-reach areas like your lingual surfaces and back molars. But if we now look with the Oral-BiO, we can see that the bristles of the brush perfectly hug around the shape of the tooth surface, ensuring that we do remove the plaque buildup that's sitting along the gum line and on the tooth surface. But the Oral-BiO adapts to the shape of the teeth. With the perfectly angled bristles, it's clinically proven to remove more plaque than a manual toothbrush, especially in those hard to reach areas. Now, visibly, they look clean, which can be misleading, but clinical results show if you look at the manual side, there's a lot of plaque left, whereas the Oral-B side has almost none. So if you want better breath, not only is Oral-B effective, but it can help reduce bad breath by 27%. So if you want better breath, we need to ditch the bacteria, and the best way to do that is with the Oral-BiO and the Ultimate Clean Brush Head.